Hi there, I'm Elizabeth Klein and I'm here to do my MI presentation on the application of MI on an addiction treatment unit in the prison system. Introduction to MI. Motivational interviewing is a collaborative, goal-oriented style of communication with particular attention to the language of change. Motivational interviewing is a more guiding style than a directive, confrontational style of conversation. Motivational interviewing has been applied to substance use treatment, correctional facilities, and healthcare systems and has been proven to be more effective due to its collaborative and guiding nature. Therapeutic community. Addiction treatment units have become more of a therapeutic community inside of a correctional facility. The offenders placed on the addiction treatment unit are required to participate in the recovery program and must engage in groups focused on substance use and relapse prevention. MI in addiction treatment units. MI can be used in several different settings, but in this case, it is the application of MI on an addiction treatment unit within the prison system. Offenders being placed on the addiction treatment unit is typically due to the offender having a history of substance use and their charges being related to substance use. Offenders often feel they have lost autonomy, which makes traditional, more directive approaches to treatment ineffective and counterproductive in the correctional setting. Motivational interviewing has been effective in replacing the traditional directive approaches to treating substance use disorder by providing a more guiding style to their approach to treatment. So, the addiction treatment unit is a therapeutic community, but once you are placed in ATU, an addiction treatment unit, then you must complete the program. It's a 6-month program. If you are an offender that's been placed in the program and you do not want to complete the program, then you will have to go to lockup for I think it's 30 or 60 days, I can't remember. So you do get a charge within the system if you refuse to do the program. But I requested to be in the program, and normally you are placed in the program towards the end of your sentence so you can get stuff prepared for re-entry into society and find an employment, a safe place to live that's conducive to recovery, looking into continuing your treatment once you're out of prison. So normally you would do it towards the end of your sentence, but I got in on it in the very beginning because I requested to be, and I was writing from receiving to staff asking if I could be on the unit. Key points about substance use. According to Schwenker, 30 to 35 million individuals estimated to have a substance use disorder, and that is a lot of people. Substance use disorders pose many issues regarding health and safety of our communities. Poor health, poor decisions lead to poor decisions, which gets you in trouble with the law, and then you face legal issues, do things that you wouldn't normally do, so it's affecting the safety of our community. Substance use affects the brain, which leads to behavior changes and poor decision making and difficulties with emotional regulation. When our brain is affected by substances, we make poor decisions, do things that we would not normally do, and get in trouble and harm others and end up landing ourselves incarcerated or mandated to treatment. History and background of MI. After working with individuals struggling with alcohol use disorders, Miller developed the first model of MI. After meeting a psychologist named Stephen Rollnick, they collaborated to develop their first book on MI. MI was originally developed to work with individuals struggling with alcohol use disorder, but now has been adapted to cover a wide range of substance use disorders. The spirit of MI. And these are things that we've gone over in our class already, but I wanted to put them in my slides. According to Miller and Rollnick, there are 4 elements of the MI spirit to include partnership, acceptance, compassion, and evocation. Miller and Rolnick note that partnership consists of building a therapeutic alliance partnership between the counselor and the client. Acceptance involves the following: absolute worth in valuing the client's worth, accurate empathy in appreciating and understanding the client's perspective, autonomy in supporting the client's choice and guiding them to be self-directed, and affirmations are acknowledging the client's strengths. Miller and Rolnick note that compassion involves prioritizing the client's needs and goals to improve their well-being. Evocation involves identifying the client's strengths, which increase their motivation to change. There are 4 processes of MI. Miller and Rolnick notes that motivational interviewing has 4 main processes, which include engaging, focusing, evoking, and planning. Engaging involves making a helpful connection between the counselor and the client. Focusing involves focusing on what the client wants to discuss, setting goals, and providing direction for future sessions. Evoking involves drawing out the client's own motivation and reasons for change. Planning involves developing a plan of action and committing to change. The value of MI and addiction treatment units. MI has become such a powerful tool to empower offenders and those mandated to treatment to make their own decision to change. Now, those that are sentenced to prison, they can't have mandate by the judge that they have to fulfill the ATU, the Addictions Treatment Unit program. So you can, even though you're in prison, you can also be mandated to complete that program. Guiding offenders to find reasons to make better choices will help reduce the risk of recidivism and relapse. So when an offender or a client can make their own choice to change and have their own motivation and reasons for that change, it's liable to stick. And they're liable to continue that behavior when they get out and reduce the risk of returning to prison. MI is based on empathy and collaboration, which allows offenders to have autonomy and take ownership of their own change process even while incarcerated. So even though you're behind those walls and in a bleak, dark prison cell, so to speak, you can still make a commitment to change. And you can still find your own motivations and reasons to change while you're there. Value of MI continued. Focusing on the individual's own reasons for change can lead them to making better choices upon release. According to Smith and Borden, MI is a useful tool in developing pre-release plans which aid incarcerated women with obtaining access to health care and housing, continuity of substance use treatment, aftercare, gaining employment, and reuniting with their families. There is a pre-release program in the prison system that gets you set up for things, all the things just listed. So you are set up whenever you are released. You know, you're only there prior to a parole hearing or prior to a release date that's already set, and they get you set up, give you ideas for employment. If you're in the work release program, you already have a job and may be able to keep that job once you are released, and just focusing on continuing treatment and aftercare. And an active addiction, we don't think about our health, so taking care of ourselves and keeping ourselves healthy once we get out is important. And reuniting with families is important. A lot of women leave their families behind and their kids behind when they have to go to prison. And so building that trust and that rapport and that relationship back once they get out of prison is important. Value of MI continued. A study has found that a confrontational approach to treatment resulted in an increase in client resistance and a decrease in client engagement. Although we're in prison and you already know you're there for punitive measures, still having somebody in your face and telling you what you should have done and what you could have done is not helpful. Having somebody come alongside you and guide you and support you and identify your strength works far better. MI is extremely effective when working with individuals that are incarcerated or mandated to treatment due to the guiding nature. Those that are incarcerated or mandated often struggle with ambivalence, and implementing MI can strengthen the individual's internal motivation to change. Ambivalence is whenever you have reasons to change, which is change talk. And then you also have sustained talk, which is the reasons that you're coming up with to why you can't change. And so MI helps you move past that ambivalence and helps you find your own reasons to change so you can increase motivation and commit to change. My discovery of MI in the prison system. I was introduced to MI when I was incarcerated in 2018 through 2019. I was there for 17 months, and I was placed on the addiction treatment unit at Camille Griffin Graham in Columbia due to my own request and because my charge was related to substance use. So in the receiving, you fill out some questionnaires about substance use and mental health. They try to figure out where to place you. Of course, you're supposed to answer those questions honestly, and I answered them honestly, and then I also was writing to staff trying to get in the unit early. I was able to get on the unit in the beginning of my sentence instead of the end, and ATU, they normally want you to come in at the end so they can do the pre-release stuff and help you out right before you're released and you're all set for when you're out. I had the opportunity that after I finished the program, I applied for the job to be a cadre, which is the offender that's on the unit that is the leader on the unit and has displayed role model behavior, supporting recovery, has done well in the program, has connected with the counselors, and we're there for like whenever we have ambivalent offenders that come on there and don't want to finish the program and they're willing to go to lockup so they don't have to finish the program. I try to identify their strengths and identify their own reasons to stay, and a lot of the majority of the times they would stay. A certified peer support specialist would come on our therapeutic community to share their experience, strength, and hope. A certified peer support is someone in long-term recovery that has a past or a criminal history due to substance use. So certified peer supports can work in a variety of settings: nursing homes, hospitals, addiction treatment units, prisons, inpatient facilities, and they are in long-term recovery, and they normally have experienced some kind of trouble due to their substance use. They may not have an extensive criminal history, but the awesome thing about peer support is that you can find a job even with a felony. If anything, it's like a prereq for the job, so that was really cool. I was very interested in that position whenever they came on there, and I was so interested in being able to look into that upon my release. A peer support guides individuals towards a pathway to recovery that is best suited for them. They come alongside as someone that you can relate to because they have more than likely been in your shoes. Our peer supports were hired by DAODAS, which is the entity that hands out the funding for state and federal for South Carolina to our rehab facilities or our behavioral health agencies. So there were two that came on our unit, and they came weekly, and they were a great help and a great support. My discovery continued. I experienced a turning point in my recovery when I was working with peer support, and that truly is so, because I remember when while I was in the program, I was still feeling like I could get out and drink alcohol. But alcohol was my main vice, and that's what led me to use substances. And I don't even know what I was thinking, but in the midst of the program and through working with peer support, I realized that that's not what I wanted to do. And I decided not to drink or do anything once I got out of prison, and I have remained sober ever since. I learned quickly that MI was a key component in their training curriculum, and that was the intervention that finally reached me, and I made the decision to commit my life to sobriety. Towards the end of my sentence, I was able to take the peer support training as an offender, and I graduated from the first cohort for women at Camille Griffin Graham, and that was a pretty big deal. DAODAS opened up the opportunity for offenders to be certified as a peer support, to give them an opportunity to be able to find employment more fitting to them and something that would support their recovery once they were released. And they've been doing that program ever since. I think it started in 2019. I did it towards the end of my sentence. I completed the program and worked as a peer support for about 4 months before I went up for parole and made parole. And once I was certified, I started working as a peer support on our unit. I got hired at Westview Behavioral Health as a peer support 3 months after being released. And I worked as a peer support for 5 years until I got my BSW degree and moved into the counselor role. The key point is that I have carried my MI skills with me throughout my transition from offender through a peer support, using MI and learning MI and applying it to myself and helping me change and decide that I wanted to live a life of sobriety, to me becoming certified while I was incarcerated and being able to be a peer support on my unit for 4 months before I was released. And then I got hired at Westview 3 months after prison, and I've been working at that agency ever since, and now I'm in the counselor role. So MI has had a huge impact on my recovery and a huge impact on my professional development, and I absolutely love MI and 100% know it's effective in an addiction treatment unit in the prison system, and also within substance use field as working as a counselor in my agency and internship currently. These are some of the references that I use to cite my work from Homan and McGill and Miller. And here is the second page for my references continued. Schwenker and Smith and Volkol. Thank you so much.